Hello and welcome to another in our series of videos, ADRA in Action. Thank you for joining us today. One of the primary goals of the work of ADRA is to serve humanity so all may live as God intended. One large contributor to that goal is helping people have good health and well-being. Health can often seem like a trendy cultural buzzword. It is often questionably slapped onto food products, clothing, and run-of-the-mill lifestyle practices. But when cultural baggage is stripped away, we realize that health is about human wellness. Being healthy is not a fad to be chased or a trend to be sold, but a right to be upheld. In keeping with our Seventh-day Adventist values, ADRA is passionate about promoting health in multiple ways. We work hard to increase access to clean water, to bring children back from the brink of starvation and malnutrition, and to restore and maintain basic human dignity for people who have been abused, neglected, or otherwise harmed. Health is not a luxury for people who can afford organic food and gym memberships. It is a central part of human dignity for all. Take, for example, the issue of water. While it can be easy to take clean, running water for granted, for many people around the world, access to hygienic water is a real daily struggle. Today, we are filming in a village that is really struggling for water. The river that runs by their village has long ago run dry. Today, after 5 years of drought, the people are having to dig deeper and deeper into the sand of the dry riverbed to get the water. I'm actually standing on that riverbed right now. The hole is behind me that they're working in. Cave-ins in the deep sandy hole can cause the death of children. A child narrowly escaped today when a collapse happened. Today, I have met Ikenya. Ikenya is one of our participants in the Together project here in Kenya. After talking with her for a few minutes, she told me about the problem of water in her village and the deep holes they have to dig to get water. I asked her to show me, and she brought us down to this riverbed. It has really brought home to me the incredible challenges that millions of people have just to get water. We turn a tap. For Ikenya, it is a 2-hour round trip to get water to her home. I asked her, is it enough water for the family for the whole day? She said no. This 11-year-old girl, suffering from hunger due to the 5-year drought, is spending 4 hours a day just getting water for her family. This is why ADRA considers our WASH projects to be such a high priority. WASH stands for water, sanitation, and hygiene. Providing people with clean water to drink, to cook with, and to bathe in is intrinsically related to the promotion of health in general, and often to the restoration of human dignity. In the thick of the COVID-19 pandemic, access to clean drinking water was sparse in the Kibera slum in Nairobi, Kenya. When people were at risk of having to resort to the sewers for their water source, ADRA managed to provide over 50,000 liters of clean water to 4,000 people on a daily basis. Safe drinking water is not only an international problem, however. Last year, communities in Iqaluit, Nunavut noticed the smell of gasoline coming from their faucets and sinks. When it was confirmed that a fuel leak was compromising local water supplies, ADRA Canada and the Seventh-day Adventist Church immediately responded, sending the community 30 filtration units to make sure people had clean water to cook with and to drink. While more needs to be done for Indigenous communities throughout our country of Canada, ADRA is proud to do what it can to uphold the dignity of Indigenous peoples. Whether it is a simple act like providing access to clean water, or a deeper experience like taking Indigenous youth on a canoe ride through the landmarks of their traditional territory. ADRA is committed to restoring and maintaining dignity for the First Nations of our land. But sometimes health is a more urgent and sensitive concern than food and water consumption. Sometimes, as in the case of pregnant women, health is an urgent emergency. But in remote villages around the world, transportation to a hospital or other healthcare facility can be a harrowing, precarious, and expensive journey. As part of our Embrace project in Cambodia, Myanmar, Rwanda, and the Philippines, ADRA created the community-based transport system. I had the opportunity to visit and observe this community-based transport system in the Philippines. Local individuals in the community were selected and trained in basic first aid and life support skills in order to assist women during long rides to the nearest medical facility. This community I visited was a local coastal community that was a 30-minute boat ride from the nearest medical facility. But on stormy times, if you go into labor, you're in trouble. You know, for communities where hospitals are far out of reach, this kind of community-based system of transport helps provide a safe birthing experience in a sanitary clinic under the care of nurses and doctors. Health is not only a pillar of Seventh-day Adventist beliefs and practices, but one of the central concerns of human life. It is not enough for people to merely exist or survive. At ADRA, we take it seriously that Jesus said, "I came that they may have life and have it more abundantly." We believe that good health is part of that abundant life, and that it is up to all of us to protect and uphold that right for one another. Thanks for watching our program on health. Please join us next time when we will talk about the current global crisis of hunger and some of the ways that ADRA is helping. We will see you then, and so long for now.